It's hardly news that the gastrointestinal tract is important to human health. It transports food from the mouth to the stomach, converts it into absorbable nutrients and stored energy, and shuttles waste back out the body. If you don't properly nourish yourself, you don't live. It's that simple. Hi, Joshua here. What's your name? Well, I can't really hear it. Just comment it down below under the video given to you by the Stomach Health Channel. Let's get on with your stomach. But in recent years, scientists have discovered that the GI system has an even bigger, more complex job than previously appreciated. It's been linked to numerous aspects of health that have seemingly nothing to do with digestion, from immunity to emotional stress to chronic illnesses, including cancer and type 2 diabetes. We now know that the GI tract is full of trillions of bacteria that not only help us process food, but that also help our bodies maintain homeostasis and overall well-being, says Dr. Tara Menon, a gastroenterologist at the Ohio State University Wexner Medical Center. The key, experts say, may lie in the microbiome, the makeup of bacteria and other microorganisms in the stomach and intestines, or informally, the gut. Research on the microbiome is still in its infancy, but studies have already found that certain environments, foods, and behaviors can influence gut health for better or worse. Here's why that matters and what you can do to improve yours. Why is gut health important? Everyone's microbiome is unique, but there are a few generalities about what's healthy and what's not. In healthy people, there is a diverse array of organisms, says Dr. Gail Hecht, chair of the American Gastroenterological Association Center for Gut Microbiome Research and Education. Most of those organisms are bacteria, but there are viruses, fungi, and other microbes as well. In an unhealthy individual, there's much less diversity, and there seems to be an increase of bacteria we associate with disease. Hecht stresses the word associate because scientists don't know for sure which comes first, whether bacteria influence disease risk or whether existing disease influences gut bacteria. Most likely, she says, both are true. We're still lacking specific proof of how this connection works, but we know it's there. Some bacteria fight inflammation, while others promote it. When the gut works as it should, these two types keep each other in check. But when that delicate balance gets skewed, inflammatory bacteria can take over, and they can produce metabolites that pass through the lining of the gut and into the bloodstream, spreading the inflammation to other parts of the body. Well, what do you think about these? Have you experienced this or tried some? Comment down below your experiences. And if you think these are useful, a like and subscribe would be really awesome for the growth of my channel. And also, don't forget about the bell icon below. Let's get it on. Specific types of bacteria in the gut can lead to other conditions as well. Studies in both animals and humans have linked some bacteria to lower immune function, others to greater risk of asthma and allergies, and still others to chronic illnesses like diabetes, heart disease, multiple sclerosis, and some cancers. Gut health has even been linked to anxiety and depression, and to neurological conditions like schizophrenia and dementia. The makeup of gut bacteria also varies between lean and overweight people, suggesting that it may play a role in causing obesity in the first place. What affects gut health? The food you eat obviously plays a role in the bacterial makeup of your gut, but so do a lot of other factors, including the nature of your birth. Research shows that babies delivered vaginally grow up to have more diverse microbiomes than those delivered via C-section, thanks to the exposure they get to different bacteria as they pass through the birth canal. Breastfeeding has also been shown to foster beneficial gut bacteria. The environment you grow up in matters too. We are way too clean of a society, says Hecht. More exposure to germs and bacteria, within reason, can strengthen our microbiomes. Go outside, dig in the dirt, play with animals. It's all good. These are things that will help establish a healthy gut. Emotional stress can also affect gut bacteria. Scientists refer to the gut-brain axis, a pathway through which signals from the gut can affect neurotransmitters in the brain, and vice versa. Research is still early, but a person's microbiome and mental state appear to be able to influence each other to some extent. Then, too, there is the role of medications, including over-the-counter painkillers and drugs used to treat acid reflux, diabetes, and psychiatric conditions. All have been linked to microbiome changes, but the best-known gut-altering drugs are antibiotics. Though they're prescribed to kill harmful bacteria, they can also wipe out bacteria of all kinds. I've seen patients on antibiotics develop allergies, or become more susceptible to infection, or have motility issues, all because their microbiota composition suddenly changes, says Hecht. Antibiotics should be prescribed when they're needed to fight bacterial infections, she adds, but doctors and patients should be careful about overuse. Can you tell if you're having health problems in your gut when the microbiome is thrown out of balance for any reason? It's often easy to tell. Bloating, gas, diarrhea, stomach pain, or nausea are all pretty direct signs that something in the gut isn't working as it should. The imbalances often fix themselves after a short time, but if they become chronic, they may require a medical diagnosis and treatment. Gastroenterologists can test for specific conditions associated with the microbiome, like an overgrowth of certain bacteria. But more and more, doctors are discovering irregularities in gut bacteria that don't cause immediate symptoms, at least not gastrointestinal ones. You can have bacteria in your gut that aren't overproducing gas or altering your motility or anything you'd notice, but that, for example, are associated with an increased risk of colon cancer, says Hetch.